Creating a Just Decision-Making Culture for Clinicians Involved in Errors by Dr. Patricia Folcarelli, in collaboration with the Institute for Professionalism in Ethical Practice.
Hello, I'm Pat Folcarelli. I'm the Senior Director for Patient Safety at Beth Deaconess Medical Center in Boston. Following an adverse event, many of you have systems to support the patient and family, to communicate with patients and families, and then systems to understand exactly what did happen during that adverse event. You may have even heard about the term no blame culture in follow-up to events like this, where you consider the nurses, the physicians, the technicians involved in the event. Today we're going to talk a little bit about a culture of accountability and how you consider clinicians in a fair and just manner. The first thing that we like to do when we're looking at what happened during an event is to ask ourselves, was there anyone involved in this event that was impaired? Or was there anybody that came to work that day with an intentional, willful disregard of a policy? Or did they make a conscious decision to disregard a policy or practice and put a patient in a state where there was an unjustifiable risk? When you're in this territory, you're really talking about something where you are going down a disciplinary path. The next thing to do is to do something we call a substitution test. A substitution test is when you consider the people who were involved in the event and you substitute in people who have the same amount of experience, the same amount of education. And you can do this by actually thinking about this in your mind, but also by interviewing people who work in that practice and see whether the decisions that were made in that situation would be the same that these clinicians will have made. What you can find out when you do something like this substitution test, is that there's been a drift in the entire practice. So everyone has developed a workaround around something that should have been done another way. Or you might even find that there's a larger organizational issue, which is something where maybe you've rolled out a new policy or a new practice and people just don't know about it. This substitution test is extremely helpful because when you're developing corrective action plans, you actually can know that there's been drift or that you need to do more work around education and training. So the first thing is to substitute in the clinicians. When people pass the substitution test, it usually means that you're not in a disciplinary mode with these employees or these clinicians. You're more in the mode of consoling them and really as trying to figure out how you can prevent this from happening to other patients or families. The other thing, though, to consider is to consider the people involved in the event and whether or not they have a history of unsafe acts. Is this a person who has had multiple episodes of at-risk behavior? For example, is this the third time that somebody's given the wrong medication? When you're in that territory, you might be in the territory with the clinicians or the staff of more of a counseling or disciplinary action territory. In general, though, what I would like to say by closing is that the fair and just approach is a core component of a safety culture. That the substitution test and the assessment of past behavior is extremely important, but that this whole thing should be applied in a context where there are human resources policies and medical staff policies that support this kind of decision-making that's fair and just. And the two, I think, very important parts about this is that there needs to be consistent application for physicians, for non-physicians, and for employees and other clinicians in the institution. But that, and this is the hardest part of it, is that it needs to be consistently applied despite the outcome of the patient. So in other words, you make fair and just decisions about clinicians involved in events, whether there's a serious harm event with the patient or whether the event leads to something that's fairly minor. And you steel yourself against making judgments about performance just based on the outcome with the patient.
Reflective exercise. Please post your responses on the comments board for this video so that others may learn from them.